What is incontinence of urine and how you can manage in the robotic surgery?
Yeah. So urinary incontinence is usually found, yes, in women who have given birth, older women because of poor pelvic flow, things like that. So for that, we can, again, when there's prolapse, the whole pelvic floor is prolapsing down. There's a weakness in it. So when we are doing pelvic organ or pelvic floor repair procedures, we can hitch them out up a lot better using 3D vision. So we can do colpopexis where we attach the vaginal vault or the uterus and the cervix up, which is all prolapsed down, we hitch them up. So it helps again, placement of sutures, placement of the hitching up of the organs. It's a lot, easier, better visualized, better outcomes because the procedure is smoother, less trauma to tissues around.